Hi, my name is Warren Sheldon. I'm a student in Dr. Chanley's Human Anatomy class, and I am a sophomore here at ETSU. Uh, my major is exercise science, and I'm planning on a future career in PT. So, what I'm doing this review video on is the anatomy of the rotator cuff, which begins with four main muscles. The first muscle, the most superior aspect, is your supraspinatus, which originates in your supraspinous process of your scapula, and it inserts itself on the superior facet of the greater tubercle of the humerus. The action of the supraspinatus is simply initial abduction of your shoulder, just initial movement. The first 20 degrees, I think. Your infraspinatus muscle originates in your infraspinous process, your infraspinous fossa, and inserts itself on the middle facet of the greater tubercle of the humerus, right below the insertion of the supraspinatus. The action of your infraspinatus is lateral rotation of the arm at the shoulder joint, which is simply just the muscle that originates right below that is your teres minor muscle. And this one originates a little bit different. It originates on the lateral border of the scapula and inserts itself on the inferior facet of the greater tuberosity of the humerus. The action of the teres minor is the same thing of the infraspinatus, which is simply just lateral rotation of the arm at the shoulder. Originating directly behind the scapula, you have your subscapularis, which originates directly on the subscapular fossa on the medial border and inserts itself on the lesser tuberosity of the humerus. The action of the subscapularis is a little bit opposite of the posterior part of the rotator cuff. It is medial rotation instead of lateral rotation, which is pretty interesting. The bony structures that is around it, you'll have your spine of the scapula, which actually acts as like more of a insertion point and just keeps these bones intact. And the scapula itself is the bone that all these just originate around. So basically your shoulder blade. The rotator cuff, surprisingly, as amazingly structured as it is, it's one of the most common shoulder injuries you'll see, especially in the sports world. And I actually worked as a PT tech for a little while at a physical therapy shop back home. And one thing that I learned is that the rotator cuff is injured, but the most common places of injury is actually in your supraspinatus. The reason of that being is what my physical therapist told me. It's the fact that this muscle right here, the supraspinatus, is actually weaker or not as strong as the rest of the ones down there. So typically your infraspinatus just has it's bigger and more compact. It's a lot stronger muscle, so it can handle more wear and tear. And the supraspinatus simply is not, which you'll see a lot more injuries associated with them. And possible rehabs, being a victim of a shoulder injury myself, it was not a rotator cuff injury, but the rehab is it's very, very, very similar. You'll start out by doing more lateral rotation and more rotating movements to start it out with, and try and keep the rest of the muscles in there strong more. So you'll do specific exercises like you'll be on a pulley and you'll raise it up to stretch the muscles back out, because after being in a sling and being cooped up for so long, your muscles will just get really, really tight and you have to stretch them back out to kind of help with all that. So possibly you'll start with just pulley exercises. You'll do where your bicep tendon actually connects, part of so say your long head of the biceps actually connects to the coracoid process of your clavicle, and that itself can interact with your rotator cuff as well, because I remember that I had to do specific exercises just to help keep my bicep strong, and it hurt my shoulder just from like flexing it. So there's all these structures are all integrated together. And the thing about it is, like, your rotator cuff is so important with everyday movements that when it is injured, there's specific things that you won't be able to do. Like a few of the tests that I actually had a privilege in performing on some patients was, I can't remember the name of the test, but I remember simply all it was just having them extend their arm out and seeing if they can apply pressure down and pressure up on with your thumb facing down or your thumb facing up. And if the rotator cuff is torn, then they simply just cannot push upon that, which is an easy way to indicate a rotator cuff injury. But anyway, that is the anatomy of the rotator cuff. I hope you all enjoyed this, and it's very helpful. Thank you.